Welcome back. I am Sister Tandy. In our last video, we established why medical surveillance matters for both employers and employees. Now we focus on the employer side of the preparation process. A successful medical examination day does not happen by accident. It takes planning, communication, and the right administrative groundwork. Let us walk through exactly what you need to do as an employer before your team arrives at the clinic or when our mobile unit arrives at your site. Your first step as an employer is identifying which employees require medical surveillance and what type of examination each person needs. This is determined by the hazards associated with each job role. A risk-based approach is required under the OHS Act. You cannot simply put all employees through the same examination. The tests must match the hazard exposure. For example, an employee working in a noisy environment requires audiometry. A worker exposed to dust or chemicals needs spirometry and possibly blood tests. A driver requires a vision assessment and a cardiovascular fitness evaluation. A food handler requires specific communicable disease screening and hygiene certification. CareNet consultants can assist you in developing a medical surveillance program that maps job roles to the appropriate examinations. This is a document every employer in South Africa should have. Once you know who needs to be examined, schedule the appointments and communicate to employees well in advance. At least 5 working days' notice is good practice. Your communication to employees must include the date, time, and location of the examination, the type of examination, any preparation required, such as fasting before blood tests, and confirmation that attendance is required. This last point matters. Medical surveillance is a legal obligation. Employees are required to attend. However, how you communicate that requirement makes a significant difference to how employees approach the day. Language that emphasizes care and benefit, rather than compliance and obligation, produces better cooperation and more accurate results. We will return to this idea throughout this module. Documentation is critical. Before examination day, ensure you have the following ready for each employee being examined. First, a completed occupational exposure profile. This details the specific hazards each person is exposed to in their role. Second, any previous examination records or certificates, if this is a periodic or follow-up examination. Third, a company purchase order or booking confirmation from CareNet consultants. If your team is using our MyClinic online system, you can upload employee information directly to the platform before the day, significantly reducing on-site administration. If you are unsure which forms are required, your CareNet consultant's account manager will provide the correct templates. Missing documentation slows down the examination process and causes unnecessary stress for employees. Good preparation on your side means a better experience for your team. One of the most impactful things an employer can do is hold a brief information session for employees before examination day. This does not need to be long. 15 minutes is enough. Use this session to explain why the examination is taking place, what tests will be performed, that results are confidential and are not shared with their line manager, and that any findings will be handled supportively, not punitively. Employees who understand the purpose and process of their medical examination cooperate more fully, provide more accurate information, and experience significantly less anxiety. This is not just good for the employees, it produces better clinical outcomes. Our Phase 4 video series is designed to support exactly this kind of pre-examination briefing. You can use these videos directly with your teams. As an employer, you have specific obligations under the Protection of Personal Information Act when it comes to employee health information. Medical records and examination results are classified as special personal information under the Protection of Personal Information Act. You may only access the overall fitness determination, fit to work, temporarily unfit, or referred for further assessment, not the underlying clinical findings. The clinical results belong to the employee. They are stored and managed by CareNet through My Clinic Online and accessed only by the examining healthcare practitioner. As an employer, you are not entitled to know whether an employee has high blood pressure, abnormal hearing, or any other specific clinical finding. You are entitled to know whether that employee is fit for the duties of their role. Respecting this boundary is not just a legal obligation, it is the foundation of employee trust. This scene covers common mistakes employers make around medical examinations, not to criticize, but to help you avoid them. Do not pressure employees to disclose their results directly to you. Do not link examination outcomes to disciplinary action unless a legitimate fitness concern exists and the correct process has been followed. Do not use medical surveillance as a tool to single out specific employees. Do not delay scheduling examinations because they seem inconvenient. The OHS Act does not recognize inconvenience as a reason for non-compliance. And do not assume that a certificate of fitness from another provider means your surveillance obligations are met. Only examinations performed by qualified occupational health practitioners using the correct protocols satisfy the legal requirement. If you are unsure about any of these points, speak to your CareNet consultant's account manager. Excellent. You now have a clear 5-step preparation framework for examination day. Identify who needs to be examined, schedule and communicate early, prepare documentation, brief your employees, and understand your Protection of Personal Information Act obligations. In our next video, we shift to the employee experience, what it looks and feels like to prepare for and attend a medical examination at CareNet Consultants. Remember, your best is good enough for today. Thank you for learning with me. CareNet Consultants, your partner in workplace health.